Thank you, Rebecca. Good morning, everyone. The Department of Health, we thrive on providing South Dakotans and the media the most updated COVID-19 information as it becomes available. And to that end, here's the latest statewide COVID-19 information. New confirmed cases, 131. New probable cases, 45. Active infections, 2,107. Recovered cases, 110,944. Currently hospitalized, 69. Total tests performed, 1,021,540. Total unique persons tested, 434,091, with 114,966 positive cases and 319,125 negative persons. We continue using the RT-PCR positivity rate, since that's a measure being used by the CDC as well as CMS for nursing home and long-term care facility reopening plans, and that last 7-day number as of this morning is 8%. Additionally, 315,171 doses have been administered to 201,813 state residents. This translates to 35% of the state population having received at least one dose of the COVID-19 vaccines. All this provisional data can be found on our COVID-19 dashboard, and that can be found at doh.sd.gov. As a reminder, our next press briefing will be held on Wednesday, March 31st. As always, we are always here to answer your inquiries as needed between then. I will now turn it over to our state epidemiologist, Dr. Joshua Clayton.
All right. Thank you, Daniel, for the updated COVID numbers. I did want to provide just a brief perspective on what we're seeing around SARS-CoV-2 variant viruses. The latest information that we have and have provided previously is that we've identified 2 persons in the Minnehaha County that have been identified with the B117 variant. Now, B117 variants, as we've identified, are likely to represent larger transmission within the community, because we are not able to do genomic sequencing on all of the specimens that are tested. This is a Sentinel program to monitor emerging variants in the state as well as across the United States. With that in mind, we have added the number of variants and the different variants of concern that have been identified by CDC. That is now in a dashboard item on the Tables tab on the COVID-19 dashboard, so look for that update today. The infections from variant viruses are typically the same set of symptoms as we see with other infections. One of the concerns, though, is that we do see greater spread of the virus with those UK variant specifically being more transmissible and has also been identified to cause more severe infections, including hospitalization and death. Now, we do have 3 vaccines that are safe and effective at preventing illness due to COVID-19, as well as these variant viruses that have been identified. So what it means for individuals and how to protect themselves is that the same prevention measures that we have been using over the past months are still effective. And getting a vaccine when it's your turn, physically distance, avoiding crowds, wearing a mask, washing your hands often, and covering your cough or sneeze. We are still seeing a higher rate of infection in the state now as compared to last summer, so about 150 cases over the past week, compared to a median of about 60 cases over the week during summer of 2020. What this would allow for increased cases if we had a resurgence, if we do see additional transmission occurring within the state. So that makes the individuals needing to get vaccinated even more greater necessity for individuals to be vaccinated, so we can reduce the risk of further transmission of both COVID-19 as well as any variant viruses. As far as an update on vaccination, so over the past week, we have seen a total of about 45,000 individuals receive either a first or second dose of vaccine. Today, we have over 200,000 persons that have received one or more doses of vaccine. And 200,000 people does not include the nearly 63,000 individuals that have received doses of vaccine from federal entities. So in total, for the United States, we have seen over 110 million doses of COVID-19 vaccine been administered. And that sort of all of the post-distribution vaccination surveillance for any severe reaction or other adverse events from vaccination has identified the main adverse events as being pain or swelling at the injection site, headache, and fever. Now that has not included any deaths, and has only rarely identified individuals with severe reaction following vaccination. So that would be an allergic reaction to some of the vaccine components. So vaccine, again, is safe and effective, and there are additional opportunities as we look at younger children potentially being vaccinated with some additional studies that are going on, additional studies around safety and efficacy among pregnant women, but all of the pregnant women that have been vaccinated with any of the vaccines have not had any sort of increased risk of adverse events, and so the vaccine, from what we've seen, is safe and effective for women childbearing age, as well as those who are pregnant or wish to become pregnant. So with that, I will turn it over to Secretary of Health, Kim Malcolm-Reinson.
Thank you, Dr. Clayton and Daniel. Good morning, and thank you all for joining us today. I want to touch on a couple of topics, and then we'll take your questions. So relative to vaccination efforts, we've seen over 315,000 South Dakotans receiving a COVID vaccine so far, and that's up 86,000 people from just 2 weeks ago. So we're very pleased to see that kind of progress. We've also seen over 117,000 people complete their full series of vaccination, which as we all know, is how we're going to get back to normal. So we're glad to see those numbers. We do remain a leader in getting shots in arms nationwide, and that's really, again, thanks to the hard work of medical professionals and others across the state working every single day to get this done. Our allocation for next week stands at 21,000, and that includes 11,700 doses of Pfizer, 8,300 doses of Moderna, and 1,000 doses of the Janssen/Johnson & Johnson vaccine. Those are new doses that can start new people. In addition, we will get the second doses needed to vaccinate folks who were receiving their first shot 3 or 4 weeks ago. In addition, this 21,000 doses that we're getting at the state level does not include the supply that's being distributed by the federal government directly to those federal retail pharmacies or to systems such as the Indian Health Service and the Veterans Administration. In regard to the federal retail pharmacy program, that continues to expand in our state, and we have locations both east and west river. We now have 65 locations across the state at chains such as Walmart's, Hy-Vee, Lewis Drug, Cardinal Pharmacies, and Walgreens has recently come online as well. So I encourage our residents to visit the doh.sd.gov website to find the nearest participating retailer or hospital system that can help them with their vaccination needs. The other announcement around vaccination is that given our increased access points and just overall increase in vaccine supply in the state, and just really how well we've been able to move priority populations, very pleased to announce that starting on Monday, March 22nd, we will be moving to vaccinate those in the priority group 1E. And so that group includes firefighters who haven't already been vaccinated and critical infrastructure sector employees. So encourage people to go to the website to find more information on those critical workers. And if you fall into those categories, please book your appointment so that you can become vaccinated. Last week, President Biden announced, his goal of being all U.S. adults having access to the COVID-19 vaccine by May 1st. And I would just say that, given Governor Noem's strong leadership and the work of all of our partners across the state, we feel that our state is ahead of this timeline, and we will, continue to move forward, and are confident that if the allocations hold up and increase as projected, that we will be able to, see all adults eligible for vaccination before May 1st. So that's pretty exciting. Just as a note, anybody that's registered for this call will get copies of the updated infographics that will show the priority groups effective starting next week. My last point is just around testing, and again, really encourage residents to please get tested if they have symptoms, if they've been around people that have had COVID, or are otherwise just interested in knowing kind of their COVID status. And so we've got, it's more convenient than ever to sign up. Go to covid.sd.gov. You can get your free at-home COVID-19 saliva test. That's available to all South Dakota residents, and we just want people to know that that's out there. And, of course, with spring break and summer coming soon, we know people want to, get back to normal, and so we just need to, make sure that we're doing all the mitigation that we can and that we're testing appropriately to help us do that. So thanks again for being with us, and I think we're ready for questions.
Thank you, Madam Secretary and Dr. Clayton. At this time, we will open the floor to questions. If you would like to ask some questions, please identify yourself, your media outlet, and then ask your question. Who would like to go first?
Are there any questions?
Okay.
Hi, Todd Dept, Kello.com News.
Go ahead, Todd.
All right, thanks. In the Rolling Stone article yesterday about Governor Noem, the author says, or makes the claim again, that the the Sturgis Motorcycle Rally was a super spreader event in South Dakota and outside of South Dakota. Madam Secretary, Dr. Clayton, do you agree with that? And if not, why not?
Todd, this is Secretary Malcolm Reisden, and I'll be direct. We do not agree with that. We've addressed that previously on some of these press briefings, and I think even from the data that the CDC has been able to collect, that cases that could be attributed to exposures at the Sturgis Rally did not contribute to a super spreader event.
And this is Dr. Clayton. I mean, one of the things that we go back to is that study that, or white paper, I should say, that wasn't peer-reviewed, that looked at what the potential for transmission, from the Sturgis Motorcycle Rally, and that in and of itself, had a lot of assumptions, and was not true to what we saw around spread of COVID-19 during and after the Sturgis Motorcycle Rally. What I would say is that anytime that you are bringing a larger group of people together, that does offer the potential for transmission. And so, when we had 300,000 to 400,000 additional individuals coming to South Dakota, there is always that potential for larger sort of transmission, not only within the community where that event is occurring, because you often have individuals from that location, but also individuals to spread that further, from where they came and along their path of travel. So, it's just a reminder that we still have a lot of work to do to make sure that individuals are gathering safely, and with COVID-19 still being transmitted at a lower level, there's still a risk out there.
Next question, please.
This is Jerry Oster, W1AX in Yankton.
Go ahead, Jerry.
Dr. Clayton, you mentioned there in your opening about the infection numbers rising to what they were early last summer. Was that as a note of interest, a note of caution, or a note of concern?
I would say just a note of caution for individuals. The being 2.5 times higher than our case numbers that we saw over the summer does mean that any increase in cases can occur much more rapidly than having a lower starting point. And so we've heard of some of the decreases that we had seen since the end of 2020 into early 2021 starting to stall out in many states, including in South Dakota. It is just a level of concern for what could happen if we do have a variant that spreads more quickly within the community, as the B.1.1.7 variant is identified to do.
Next question, please.
Deb with the Black Hills Pioneer.
Go ahead, Deb.
My question is, when we had the last news conference, there wasn't really any mention of teachers, and then within that next week, the federal retail pharmacy program opened it to teachers. What changed within the state, or were they allowed to get it per your protocol?
Thank you, Deb, for that. And yes, you are correct that the federal government directed the federal retail pharmacies to start vaccinating teachers, and the state moved shortly thereafter to that next phase. We were ready to move there with our state allocated doses as well. And we've seen great progress working through the teacher population to the point where we feel that we're ready to get down to that 1E population starting on Monday.
Okay, thank you.
You're welcome.
Next question, please.
This is Jonathan with the Argus Leader.
Go ahead, Jonathan.
Hey, Dr. Clayton, you cited a number of 62,000 individuals that have been vaccinated through federal entities. Where are you getting where are you guys getting the data for the people vaccinated through the federal pharmacy program there?
So this is actually not specific to the federal pharmacy program. It is inclusive of primarily of Indian Health Service and VA, and those are data that we do receive in aggregate as part of our discussions with CDC. So that information is added to the 1-dose and 2-dose percent coverage, which is on the vaccine tab in the upper right-hand side, is showing that this for today's update, that we're at 35% for 1-dose coverage, and about 20% for 2-dose coverage. So 34.74% 1-dose and 20.24% for 2-dose coverage. That does include that data from all of the federal entities, those that are part of the pharmacy program that are reporting directly into our immunization information system, as well as VA and IHS that only report to the federal government.
Is there a separate place where you can actually see where federal retail pharmacy data is coming from? I mean, is there a place where we can get that data?
Jonathan, no, those pharmacies are enrolled in our immunization system, and so we get the data as they provide vaccinations, and we report it just like we report out on the state allocated doses.
Okay, thanks.
You're welcome.
Next question, please.
Austin Goss, Dakota News Now.
Go ahead.
You guys mentioned at the top of the call just how the president had expressed his desire to get a vaccine to every American adult by the end of May. And I know a number of other states across the union had expressed a timeline as to when they think it'll be available to adults 18 and older. I was wondering how far off we might be from a timeline regarding when it'll be available to all adults, or if you guys have a rough guess as to when it will be available to all adults?
Well, Austin, you know, again, we're going to start with the 1E population, and just as a reminder, anybody that's been eligible to receive vaccine but who has not received it does remain eligible, and we want to encourage those folks to still sign up. And so if you can help us make that pitch, we would sure appreciate it. But when we start the 1E population next week, I think it's about, is it 227,000? So we estimate there's about 227,000 people in that group. So we're going to want a little bit of time to help that group get through before we open it up to all adults. But again, I'm very optimistic that we will see that occur, again, based on the allocations that we're getting into the state before May 1st.
Thank you, ma'am.
Next question, please. Can we please have the next question?
Okay, I'll jump in with one. Todd Epp again, Keldo.com News. Dr. Clayton, you had mentioned about the rate has increased, and Jerry Oster asked you, more details about that. And you said it was these variants that are more virulent. We're also seeing, however, most of the mask mandates for the larger communities in South Dakota either expired or get taken down. So very few communities still have mandatory mask mandates. It's not to say people still aren't wearing masks. Is there any correlation with the end of those mandates with the rising rate that you see?
So again, the information that I was presenting compares our case count over the summer to what we saw in the past week. And so, we have seen, level number of cases since towards the end of January. And so, we have not seen any, at this point, impact of mask mandates expiring. And we would caution that, individuals, even though there's not a mandate, that they still continue to take the same precautions as they would have, which includes wearing a mask and physical distancing, when they're in situations where they are not able to avoid individuals and be 6 feet or greater from them.
Next question, please. Hearing no
Jody
more
at
questions.
That Business.
Go ahead, Jody.
Quick question. Is there going to be any verification required as far as proof of employment as these critical infrastructure employees are coming in? Is there any standardization as far as that's concerned?
Jody, no, there is not a proof of employment requirement, and the reason for that is there's just lots of different ways that employees would have to do that, and that makes the process very cumbersome for both them and then for the vaccinators. And so, we've really, I think, been fortunate that as we've worked through the priority groups and asked people to attest that they meet whatever the priority group is that we are in, that we have had, a good showing with that, and people have been honest and truthful. And so we'll continue to use that approach and rely on people to, be honest when they come forward if they, in fact, qualify for vaccination. And so far that's been working just fine.
Okay. We have time for one more question. Can we have last question, please? Hearing none, we would like to thank you for joining us